Now, in depth on the biggest entertainment stories from around the world.
Well, Rosie is lucky she got to the doctor in time. Heart disease is the #1 killer of women. And joining me now is a chief surgeon at Cedars-Sinai Hospital, Dr. Sonu Ahluwalia. So, doctor, what does a stent do?
Nancy, a heart attack is when the blood supply to the heart stops, right? And so a stent is a tiny tube that we put into the artery to keep it open to either prevent the heart attack from getting bigger or to prevent a heart attack at all.
So what are the symptoms that a woman should look for?
Women have symptoms that are quite different from men. You could have nausea, you could have shortness of breath, you could just have a feeling of indigestion. These are all things that we don't correlate with a heart attack, but that's what happens in women most of the time.
Rosie has had plenty of heartache this year. Her talk show on OWN was canceled after just 5 months, and her fiancé, Michelle Rounds, was diagnosed with a rare medical condition, plus her continuous battle with her weight, something she talked openly about to Dr. Oz.
I gain weight all in my stomach to the point that sometimes people will say to me, "Are you pregnant?"
Recovering at home today, Rosie got a tweet from her adversary, Donald Trump. "Get better fast. I'm starting to miss you." And her reply, "Well, thank you, Donald. I must admit, your post was a bit of a shock. Are you trying to kill me?"
I'm so glad she is okay. Well, looking forward, is Rosie's diet going to change? Will her doctor ask her to do that?
Yeah, Nancy, what's going to happen is Rosie's doctor is going to measure her, the amount of cholesterol she has in her blood, make sure her blood pressure is okay, see if she's diabetic, and based on that, her diet will change. So it may be a low-fat diet, it may be a low-sodium diet, but, her physicians will decide that.
Makes sense. Yes. Thank you so much for being here, doctor. I think you have a surgery you got to get to now.
I do.
Actually, he does.